So now we're trying to look at the next aspect of what? Gastric ulceration. So we're trying to look at the clinical features. So clinical features is more of like the signs and symptoms. You understand? So clinical features of acute gastric ulcerations. When you say something is acute, it's occurring all of a sudden. Gastric is the stomach. Ulceration, there's formation of ulcers. Right? So clinical features of these acute gastric ulcerations. Let's move on it. So we said that it's typically present with sudden onset of epigastric pain. Right? Let's not jump, right? So symptoms: epigastric pain is sharp, is burning, there's a gnawing pain, feel like something is drawing you inside, located in the upper abdomen. So timing of pain is often shortly after meals, so after you have eaten. All right, there's nausea and vomiting, there's weight loss, and you don't want to eat. So as a result of that, you are losing weight. All right, because when you eat, there's pain. So why should I eat? And sometimes when you eat, there's still non-digestion. Okay, so a lot of gas in your stomach, that's abdominal bloating. Early satiety is once you start eating, you feel like you are full. Okay, so complications: it could lead to bleedings, it could lead to hematemesis, it could lead to melena, that's black stools. All right. So it could also lead to abdominal perforations, it could lead to penetrations. So ulcers could actually erode into adjacent organs. So for obstructions, it could lead to swellings or scarrings at the gastric outlet, leading to persistent vomiting. Alright, so those are all the signs and symptoms you see the patient having what? Gastric ulcerations.